Welcome back to my channel, and I'm so excited if you guys decided to stick with me. Let me tell y'all, I do apologize for not putting out that second part of my study labs video, but I have a lot of things to tell y'all that would definitely make up for that, and I will also be putting out a video on that as well later on today. So guys, the end of 2020, let's talk about it. My grandma ended up contracting coronavirus literally 5 days before Christmas. So it was very hard for me and my family because I couldn't go see her, but my mom lives with her and my siblings, so she was able to take care of her. Good thing my mom, nor my sisters and my grandpa, they didn't contract it. Thank God for that. But my grandma had a lot of the symptoms. She had the loss of taste, the loss of smell, the headache, the hallucinations, the fever, the body aches. I mean, you name it. So she is getting better now, but a lot of patients after contracting COVID 19, a lot of them end up having pneumonia. So right now she's going through pneumonia, but thank God she's at home. She's like on antibiotics and things like that, Zofran for nausea, and a steroid. So she is getting better and she's gaining her strength back. So I'm so excited for that. So, y'all, I started my new job at the end of 2020, literally the week of Christmas, and it was the best decision that I made for myself. I love my job. Like, I'm so surprised. I wake up every morning, especially my work days, and I'm just excited to go to work. I have a smile on my face. I'm happy. I'm not stressed out. I'm just ready to see what type of day I'm going to have. I absolutely love it. But before I start telling you guys details of that new job, I got engaged and I'm so excited. My fiance proposed to me December 23rd, which was a rough day for me, but him doing that just made my day the absolute best. So I'm really excited to be planning a wedding. So I'll definitely be sharing details with you guys about that later on. So let's get to this new job information. So you guys, I am now currently working 12-hour shifts at an urgent care. And I love it because besides MedSurg, I was getting a lot of skills, but we absolutely do a lot of skills at this urgent care. I mean, we have an x-ray tech in the building. We have PAs, we have nurse practitioners, we have MAs, and of course we have us nurses there as well. So my shift consists of me, clocking on, making sure the EKG is working, checking the AED, checking the crash cart, running quality checks for the urine log, quality checks for the COVID test, strep flu, and also I have to check the temperature for, the labs and the medications that we give. So urgent care is a totally different world from the hospital. It's very fast paced. The hospital is fast paced as well, but they're not one and the same. It's totally different. You're working with different providers. You may be working with different people every day, so you learn how to work together as a unit, even though it might not be the same people consistently every time you work a shift. But I love it though. So compared to the hospital, when I was working just med-surg, the only injections I was experiencing was sub-Q, which was of course giving insulin a lot of the time, or Lovenox. But now that I'm in an urgent care, guys, in school, because of the pandemic, I did not get to have any experience of doing IM injections. Now, IM injections are like the daily part of my life. We give mostly IM injections, of course, because urgent cares, we don't give insulin. So the IM injections are mainly given in the deltoid or the glute, and it depends on the dose that the provider is providing and also on the medication. So we do a lot of Tdaps, we do a lot of antibiotics, so we give a lot of Rocephin. There's Toradol at times, and also steroids that we give IM for these patients that come into the clinic. We also do TB tests. So I never also got to experience that in school. So we have TB tests a lot. We have people either coming in because they're starting a new job that requires a TB test, or a person like us wants to become a nurse or is currently a nursing student, and it's time to get them a new TB test. So it's certain things that I am love doing that I didn't get to do in school nor in the hospital. Also, we do a lot of drug tests. A lot of jobs may send their employees to come get tested where I work, or a patient or a client might come in because they need a drug test for like a court hearing and things like that. So we do drug tests. And guys, we actually do IVs in the urgent care. So I am definitely not missing too much experience in the hospital. Besides, I'm still getting time management. I'm still doing IVs. I'm still doing blood draws. So I was a little weary of blood draws because I was like, okay, I did IV before, but I'm not that confident in it. I haven't done that many of them. So I had my first blood draw, and it was for a COVID antibody test. And I was not nervous. We have the butterfly needles, and we also have the straight needles as well. So I used the butterfly needle. I seen how the technique went, got my patient, and bam, got it on the first try. So the blood draws are fairly easy. With an antibody test, you only need one tiger top. If you're doing STD testing, which we do that as well, you have to have two tiger tops. So I just think it's amazing that I'm doing blood draws now, and I'm still having the opportunity of doing IVs. Now, the only time we do IVs if we have a person that comes in that's severely dehydrated and can't do much for themselves. So we have to hydrate them before they leave. But if they're conscious and, they're talking and stuff like that, we just, tell them to increase fluids when going home. So the IVs are really used like in extreme emergency situations. So I'm definitely not losing those skills either. We also catheterize patients like an in and out cath only if we need some type of sample for urinary retention, if we have to get a urine culture and things like that. STDs, we do full panels, so sometimes we have to do a GCT or all culture, a full culture on that particular patient that comes in as well. It seems like I'm rambling too much. For the blood draws, after you draw the blood, you have to let the tube sit for 30 minutes, and then you put it in a centrifuge in order for it to start clotting. And then, of course, blood is refrigerated. For our urine samples, they can be we keep them room temperature, but they can be either room temperature or refrigerated. But you have to make sure you document which one of those you're going to do for the urine. I also got the experience of doing an EKG last week. I had a patient came in, chest pains, shortness of breath. So we ran an EKG on her. She also got an x-ray done. So I thought the EKG was going to be terrible. Like, oh my God, I'm not going to know how to connect all these wires because I know how to connect a heart monitor, but not an EKG. But it was fairly simple. Somebody told me how to do it. I went in there, got to work, did it, and the patient, she has to follow up with a cardiac doctor because she does have a history of cardiac issues in her family. So, but guys, I just never thought I was going to be getting this much experience working at urgent care. It's really like more than I thought. I mean, we triage the patients, when they first come in, get their weight, bring them into the room, ask them what medication they're currently taking, if they have any allergies. We're asking them medical history, surgeries, hospitalization, family history. They smoke or drink. We get their vitals and things like that to just help us know what's going on before we go to the provider. Because you have to have as much information. And of course, their chief complaint of their visit, much information going to these providers. Because if not, you're going to be looking crazy when the provider asks, well, did you ask this? You just have to learn how to assess things. We also do ear irrigations, which is also interesting. I haven't done my first one yet, but I actually got to see it, and I was just like, wow, that much stuff comes out the ear. Like, I couldn't believe that much wax can actually build up, and it comes out pretty quickly. So we do that as well. We also do splints and apply braces to people that may have broken something. So that's also interesting. You know, somebody comes in with a broken bone and they go to the x-ray and it's verified that they have a fracture and we have to wrap them up. So Google becomes your best friend on the go if you don't know how, but we also have a manual in there that we can just read through and try to see how to do it, because you know sometimes you might not get too many patients that come in that actually needs an x-ray and you're like, how in the world am I supposed to do this splint, because you know it's so many different ones. So that's another cool part and aspect of the urgent care. And I also want to tell you guys, I am really working close with COVID now, working in urgent care. I mean, you could imagine we probably do 70 plus, almost 100 COVID swabs a day. We do the PCR test, which take 2 to 5 business days for the results. And we also do the rapid test, which you get the results in 15 minutes. So, you know, we have a lot of those. We do get a lot of positives. We're working very close with it. And we also get negatives because some people come in too early. They're coming in, you know, prior to day 5, 7 of having the symptoms. You're going to get an inaccurate read. So we always tell the patients it's best to come in either day 7 of the symptom or day 10, so we can actually get an accurate read if they're actually COVID positive. Because some come, I got exposed yesterday and I want to get tested. Well, I mean, you can get tested, but you're going to get a false negative because you didn't even give it time for the virus to incubate. So right now, I've been behind too because I just developed a stuffy nose 2 days ago. Today I will be going to get COVID tested. I'm only having a congestion. I'm thinking it's sinus, but we have been having a lot of patients that just comes in with a stuffy nose, no fever. They have their smell and taste, no nausea, no diarrhea, and they test COVID positive. So I'm just hoping that I'm not one of those people that test positive today, because I do have a lot of things I need to do and a lot of plans, and I love going to work, so I would hate to sit out because I got COVID. But I think I'm fine. I think it's actually sinus. So I'll figure out my results today. I'm actually going to get tested at work later on today. I'm off today. So my schedule is 9 to 9. Well, 8:45 to 9. So we get they like us to clock in for 8:41 so we can have huddle for 8:45 and then have the patient rooms, have everything stocked and ready for when our patients come in. So it just gives a better flow. So we work 9 to 9. We don't lock the doors until 9. So if we have somebody walk in at 9, we have to see that patient. But I don't mind it. I mean, it's overtime. So a week for us, we work 3/12s, and then the following week we work 4/12s. So each check after 2 weeks typically gives us 80 hours on a check. And my previous check that I had received was, I want to say, like 1,700 before taxes. And then I was missing a couple of hours because I was in my training period. So yeah, I mean, I like the urgent care. Get paid really good, have really good incentives, have great health insurance. So you guys might actually be interested in that as well. And I mean, I'm still getting the skills I get on MEDSURG, and could always go PRN on a MEDSURG unit or in a different specialty area that you guys might be interested in. So guys, I hope y'all enjoyed this video. I hope it wasn't boring. I do apologize. I knew that you guys probably were missing me because I have been MIA for a while, but life happens. I had a lot of life stuff going on, but I definitely will not allow life to have me slowing down on making my videos for you guys. And y'all just be on the lookout. I have the last lab video for preparing for NCLEX. For those of you who aren't licensed yet, I will be putting out the next study video for studying for labs for NCLEX 2021. So I'm excited, guys. If y'all have any questions, just drop them down in the comments. Anything y'all would like to share. I'm just trying to get close to you guys. I just feel like, you know, I'm slowly becoming a family with some of you guys, and I do appreciate you guys that have reached out to me. and I am willing to show you an example of my resume. If you reach out to me, I'll email it to you, a cover letter, what have you. So I hope you guys enjoyed this video. Y'all take care. See y'all later.